All right. Good morning, good afternoon, and good evening, everyone. Thank you so much for joining today's Unite session titled Empowering the Next Generation Youth Engagement in Digital Health Governance in Asia Pacific. About myself, I am Paromita Roy, and I'm the regional coordinator for the region of Asia Pacific at Unite. I'm also your moderator for today. I would also like to let you know that this session is organized in collaboration with Youth. Youth stands for Youth Ownership of Digital Health, which is a volunteer-led community of digital health professionals under the age of 35, aspiring to be the next generation of leaders driving change in the digital health space. Before we begin, I'd like to quickly run through the housekeeping rules. Number one, the session will be an hour long and we'll divide it into three segments. First, we'll set the context. Next, we'll have a presentation by Path and by Youth. And lastly, we'll turn to our parliamentary engagement segment. Rule number two, please keep yourselves muted, especially when our parliamentarians are speaking, to have a uninterrupted session. Thank you so much for your cooperation. I'd like to now pass the floor to my colleague and Unite's Digital Health Policy Coordinator, Arshia Singh. Arshia, the floor is all yours. Go ahead.
Thanks a lot, Paramita. Once again, greetings to everyone present, to all the honorable parliamentarians, the respective legislative staff, and all the other members from the youth community that have joined us here today. Just as an introduction, my name is Arshia Singh, and I'm the policy coordinator of the Unite Digital Health Hub. Also, yesterday, that was 12th of August, was International Youth Day, and it's rather coincidental, but also a matter of great significance that we're having this particular session today. Theme of the International Youth Day was actually just a sec, I'm having slight problems with my, with the theme of the International Youth Day was actually from clicks to progress, youth digital pathways for sustainable development. And we all know how important the youth community is, or young professionals for the matter of fact, is within the global health space to accelerate universal health coverage. I see that we have some new parliamentarians who joined us today, but also a number of new participants that have engaged with us. So for the time's sake, I would like to briefly introduce the work of the Unite Digital Health Hub. For that, I would like to share my screen. Please give me a heads up if you can see it.
Yeah, go ahead, Arshia.
Perfect. So we have been able to engage over the past 3 years of work, and this is our third year of running at Unite with the work on digital health. We have been creating awareness and also increasing engagement on significant aspects of digital health for parliamentarians across national, regional, as well as the global level. We have three focus areas or rather regions of work, which are APAC, which is the Asia Pacific region, the Latin American region, and the Southern and Eastern African region. For the past 2 years, we've been focusing more towards Latin America and Southern and Eastern Africa, and we've been able to cater significant impact over there. And this year, which is our third year, we intend to create the same level of impact and increased engagement in the APAC region. In this time, we've been able to successfully engage with over 150 parliamentarians across the regions on digital health issues such as health data governance, sustainable financing, and gender and digital health. As you can see on my screen, that we do have some national level achievements to sort of report. We have been successful to also organize workshops curated for parliamentarians, specifically in Tanzania, on digital health. And we've also established a multi-stakeholder group to contribute constructively to the implementation of the National Digital Health Strategy. We're also conducting a number of roundtables and consultations with the Member of Parliament in Kenya for her private member bill on digital health and telemedicine and electronic health records, which is in progress, and we hope that we are able to create a significant impact over there. In Argentina, we have led advocacy with parliamentarians to establish a national digital health agency that can look after digital transformation and also focus particularly on research and development. We have actually also submitted a legislative proposal of a legislative agenda after the elections in Argentina last year to the respective ministries of Ministry of Health and Ministry of ICT pertaining to digital health transformation. At Unite, we've also engaged with MPs of Ecuador and providing them a multi-stakeholder perspective to recognize the requisites of a digital health legislation. And we are in the process of drafting a draft digital health legislation with a cohort of MPs from Ecuador. At the global level, we believe that evidence-based policy making can only happen when our parliamentarians are well aware and well equipped with the right kind of material and resources to support their engagement, both at the national level, regional level, and the global level, of course. Recognizing this, Unite and Transform Health have recently released a policy toolkit for parliamentarians on harnessing digital health for universal health coverage. And the toolkit looks like this. The toolkit contains tools and resources to support parliamentarians to champion on digital health issues in both global and national contexts. We do have a policy brief. We do have advocacy letters, parliamentary questions that can be raised by parliamentarians on digital health, and also some country-specific snapshots, which also contains countries from the APAC region to broaden and support universal health coverage goals. Apart from that now I've introduced the desk, I would like to speak a little bit and a little bit of context on today's topic, which is the youth engagement in digital health initiatives across the world. And we all know that health and well-being outcomes are likely to be a litmus test for the capacity of societies to harness digital transformation and support UHCs. And young people aren't just learners, but also ideators, creators, and doers to achieve Sustainable Development Goal 3 for good health for all. And youth and investing in youth and giving them a real sane policy is what will accelerate this movement of universal health coverage. And we firmly believe at Unite that through Unite and its parliamentarians, we can develop smart and adaptable governance strategies that can really transform this process and have a healthy impact, not only on youth population in terms of their health, but also their engagement in policy making. Parliamentarians are key players and key stakeholders for advocating for youth inclusive policies and support their initiatives in their country context for better health opportunities as well. And with this, we are more than proud to be collaborating with youth. That's the Youth Ownership for Digital Health. I think I've said enough, and I would like to state that I'm really eagerly looking forward to have this discussion and take all the inputs by our parliamentarians and also our experts from youth, and eagerly looking forward for this engagement. Thank you once again for giving me the opportunity and having a session on digital health and youth. Thank you so much.
Thank you so much, Arshia. Next, we have a presentation by Pallavi Jain, Program Lead at Youth. Pallavi, just unmute yourself, please.
Thanks, Paramita. Great. Good afternoon, everyone. And it's truly an honor to be collaborating with Unite today and be in the presence of, our honorable parliamentarians and all of you who are here, to engage with us on, the active collaboration of the youth in digital health. I am the program lead at PATH, and I'm leading the Youth Secretariat, which stands for Youth Ownership of Digital Health. And I will be very happy to talk to you through the youth platform that we've created and what is it that we're trying to do the platform and how we can ownership in digital health amongst youth even more far and reaching. This presentation doesn't seem to be moving for some reason. Great. So YO.DH is essentially a volunteer-led community of young digital health professionals under the age of 35 who aspire to be the next generation of leaders in the digital health space. YO.DH is envisaged as a self-sustainable entity by the members themselves. And the whole idea is to bring together young folks so that we can help them give a platform which can help enhance their representation, their knowledge and networks within the field of digital health. Our mission is to provide these young professionals with increased representation and networks. And the ultimate goal is to create more future leaders in the digital health space. Currently, we are about 800 members strong with about 53% of women members. We are present in 20 countries and 22 Indian cities. And we are rapidly growing. And our vision and our mission is shared by many of our collaborators. And when we came about with the idea of YO.DH, which was last year in July, the understanding was that digital health is a space which is growing, which is booming. That is the future, especially after we all faced the pandemic. Technology is the way to go to when we talk about concepts such as universal health coverage. Without technology, the scale up of health is possible. And we realized that technology is something which innately rests in the hands of the young people. So how can they not be in the forefront? So with this, with understanding this gap, and with seeing the bolstering future of digital health, YO.DH came about, and today we are about 800 strong member community. Our idea is that through the YO.DH platform, professionals in the digital health space are able to connect, create, and collaborate with each other. And we are trying to do this with through different community engagement, capacity building, and networking initiatives that we have, which I'm just going to talk about, with the ultimate goal of creating future leaders. So as a part of YO.DH, we have 7 different initiatives. We have an ambassador program where members from within the YO.DH community are a part of 3-month programs, and they help in conceptualizing different programs. They help in convening those programs and truly taking ownership of all the initiatives that we have a part of YO.DH. We have something called as YO.DH Charcha, which is our online webinar forum, which happens on a monthly basis. We have YO.DHA, which is an open house forum, which gives a platform to all our YO.DH members from across the world to come together and have meaningful conversations around digital health. We have YO.DH Dialogue, which is our podcast series. We've released 5 podcasts so far. Next one, which is soon going to be coming out, is actually by Ricardo himself from Unite. We have YO.DH Discovery as well, which is organized field visits for our YO.DH members, where they actually get to experience centers of innovation around digital health. We have YO.DH Fest, which is our in-person knowledge sharing event. We recently had one last month, and we had about 200 YO.DH members from across the country come and join us. And we are in the process of soon starting our mentorship program as well. You can be a part of our knowledge sharing initiatives. You can connect with us. You can consume a lot of the products that we've created through our different social media channels as well. Going forward, how we envisage YO.DH is that this community can grow and truly become into a global community. We wish to establish YO.DH and position YO.DH as a community which is a go-to forum in the digital health sector. This community will be a platform where people can come together from within the digital health space. They can connect with each other. They can network with each other. They can collaborate. And we want to focus on building capacity of our of these digital health professionals, so that when they are in the position to lead, they already have developed networks and a developed skill set and are abreast with the latest technologies and the advancements that are happening in this field. We are also aiming to come up with city-wide chapters, so we can have more local engagements. We are looking at partnerships with international organizations, with CSOs, with for-profit organizations, and with institutions as well. A lot of students are are interested to be a part of the community, so that they truly can understand what digital health means, what the future of digital health holds. So we are right now in the midst of seeing that what is the potential of this platform. We are open to collaborating with multiple partners. If there are organizations or if there are people who resonate with with the mission and vision of YO.DH, we are very happy to have strategic support partners. We are open to having knowledge partners who can actually help us build a knowledge product, as well as organizations that can help us build capacity of our youth members. Yeah, in case you think you want to be a part of YO.DH, you are a digital health professional under the age of 35, you have something to contribute within the field, we will be very happy to connect with you and be a part of this community. In case there's time permissible at the end of the webinar, I'll be very happy to answer questions about YO.DH. But for now, Paramita, over to you. Thank you.
Thank you so much, Pallavi, for that elaborate presentation. Next, we have Dr. Sharan Murali, who is a scientist from the Indian Council of Medical Research and is himself from the youth community. They will be speaking on what does the youth want to see in the future of digital health governance. Dr. Sharan, please go ahead.
Thank you. Thank you so much, Paramita. So good afternoon all. I'm very grateful to youth community as well as Unite for this opportunity. And it's an honor to meet the parliamentarians online here today. So I'm going to speak more from my experience of talking to our youth members and learning from the field. So let me begin with the basic question of what is digital health. So it's basically the use of digital technologies to enhance and deliver the healthcare services. However, although it looks very simple, the canvas is very broad because it brings together various sectors, including medicine, public health, technology, governance, finance, development, etc. So we all agree that there is a boom that is happening in the digital health space, and it's growing faster than we all could imagine. And because of these, some raising concerns are also coming up. For example, issues regarding equity, issues regarding inclusivity, data security, privacy, etc. So currently, many tech solutions that are in place are not very user-centric. They are basically trying to answer the questions that the governments have and not really helpful in the field and are not interoperable. So by interoperable, what I meant is, we have, let's say, an example of, say, HIV program, and we have a tuberculosis program. So these are vertical programs, and they have separate funding for each of this. As a result, both of them have two different technological solutions for, to be implemented in the field. And this leads to an IT burden. Imagine the number of diseases that we have, 30 plus applications to be filled by a community level health worker. So this leads to problems of inclusivity, not representing all the genders and the poorer socioeconomic classes. And also, since most of these are led by technological giants in the country, bulk of these are business models and not the model for change. So that is where the youth want to come in. We are early adapters. We come up with creative and inclusive solutions. We aim for equity, and we are part of multiple incubators in the country, including, the Indian Institute of Technology and various other NITs. And we come up with sustainable ideas and solutions which are more user-centric and design thinking oriented, because these are done as a part of our research work initially. And then the youth are also welcome for feedback and change. So we want to be something more than being a passive beneficiary. We want to be active contributors and leaders who are, shaping the future of digital health through our creativity, advocacy, and engagement. But, it's still not reaching there. So what does the youth want is the question that we are trying to address today. So to all the parliamentarians out here, we want support. We want an avenue to be heard. Say, for example, the government is trying to government needs a solution on a particular problem in the country. We feel it is better if you put it out as a call for, solutions, so that the youth in the country can come up with their ideas, present their ideas, do a pilot model, and that gets funding and later get absorbed into the public health system. Right now the incubators are there, we work there, but our ideas don't reach the public health sector, basically because we are not able to demonstrate it to the parliamentarians who are directly involved in the policy making. So that is one thing we want, sir. We want an opportunity to showcase our talent, whenever there is a need from the government side. We also want to emphasize that let's not build, waste money by building newer systems, because already there are a lot of existing systems in place, and we want to start integrating all of these systems together, have a single sign on, have interoperable solutions, and have user research as a part of the protocol, initial protocol itself. It's not that we develop something, we finish the game there. It starts the game there. We have to always go back to the user, find out what works, what doesn't work. But in bulk of the policies that are implemented today, the user research is not a major factor, and that is where we want to come in, sir. And the concept of design thinking, having a bottom up approach rather than having a top down approach, include the user in the development itself. The government wants this, we want to capture this data. How do you want this data to be captured? So we would want the user to be part of this. Only then we can come up with sustainable and future proof solutions. Say, for example, the program's funding is only for 3 years. Does that mean that all the data that we have collected for the next 3 years will be dumped at the starting of the 4th year? What is our vision for the long-term collection of this data and using it for the public good? So we need to have such visions. Coming to last point, that is ethics. We as youth, we are very concerned about our data, our privacy, etc. So let's capture very minimal information, what is required for the governance and for the policy making, and then sync it across all the systems. Let's not capture a lot of data and then have problems of storing it. And let's make sure all these systems adhere to the data privacy policies and security terms. So let me conclude my session by telling that we want to be part of the decision making processes, not just being a technological giant. The youth wants to be part of this, because whatever you are building today is for us in the future. So thank you all, and I'll be, like what Pallavi said, I'll be open to have a conversation with you all at the end of this. Thank you. Over to Paramita.
Thank you so much, Dr. Sharan. That was a very powerful presentation. We'll now move on to our parliamentary engagement segment. And we have 2 key questions for today. I'll start with the first question. So the first question is, in what ways can parliamentarians and policymakers in the Asia-Pacific region effectively engage youth in digital health governance, ensuring their contributions are valued and considered in the decision-making processes? And first, we'd like to hear from Dr. Amar Patnaik. Dr. Patnaik, please unmute yourself and go. The floor is yours.
Thank you so much, Paramita, and thank you to all those presentations which were made by Arshia and Mr. Sharan Murali. And greetings to all my colleagues from other countries who are present here. I think the involvement of youth in digital health is particularly important in a country the size of India, both in terms of geography as well as in terms of population. Now we have setups. Health setup is organized structurally in a vertical fashion with the central government institutions of health. There is a Ministry of Health, which is a policy-making body for the entire country. but health is a state subject. Health is left to the provincial states. So large amount of implementation is done by the states, and makes sense in the sense the cutting edge where it gets implemented will be the villages, and they are under the state jurisdiction, under the chief district medical officers and the organizer, the health officials below them. In terms of geographical spread, each region, each state has a different health issue. There are some common problems, but then there are separate specific health issues in different regions of the country. Some problems in the mountainous regions, some problems of different kind of disease in different parts of the plains or in the southern tips of the country. So the canvas is too wide, too deep, and too broad, not to adopt digital solutions. And that is what is, I think, the first recognition that has to be made. Fortunately, this recognition has already been made by the government of India, I think, and also most states, thanks to a large measure to the COVID pandemic. During the COVID, there was no other way but to jump to the digital method of addressing the challenge. And as a consequence, in India, which is, in fact, I must thank the Unite for it, because when they came and had their board meeting, and I took them to the National Health Observatory. I myself, as an MP, parliamentarian, or even as a bureaucrat before that, never knew that such a thing existed. And when we went there, it was great to see the kind of data that has been collected, that is being collected regularly from the village level itself, and the way it is being analyzed using artificial intelligence to give policy directions, which is evidence-based policy making, that's happening. This entire structure is, I thought, looking at the way it has come up, it is through largely youth who have developed these applications, who have developed the models, the algorithms, and have understood this. The scientists who are involved in this, data scientists as well as health domain scientists, they were all young people. And it was very interesting to see that this has come up. And Ricardo was very surprised because of the size of a country like India, with like some 800 districts and number of villages. I really lost count, because in my province itself, there are 68,000 villages. So if you multiply by 30, that would be something is number of villages. So this is the kind of data that is being generated. And evidently, this can be profitably used, definitely, for dispensing better healthcare and achieve something of a universal healthcare, at least move towards universal healthcare in the country. What it does address does to address the issue is the issue of rural-urban divide. Rural-urban divide. I think this rural-urban divide is significant in the health sector. You have the primary health centers in the rural areas, but the tertiary centers are in the cities, are in the big towns. The primary healthcare centers may not be as well equipped in terms of infrastructure, both physical as well as human resources, to address the issues of the community at that level. So when I heard this presentation by you, I was very impressed that such a kind of initiative was being taken by them. I have a suggestion to make to them. And that suggestion is that, yes, we create leaders through your program, which is extremely, it's laudable, it's praiseworthy. But let's create grassroots leaders, because I think what India, a country of like India, needs is grassroots health leaders. Now, who are these grassroots health leaders? Starts right at the village, the ASHA workers. The ASHA workers are the ones who should be trained. Most of them are young. Most of them are trained to some extent, because it is not possible to train them physically by calling all of them to one place. So whatever they pick up, I think along the way, there is some amount of training. It's a national program as well. But if you adopt digital technologies to build their capacity, and exchange ideas, I think there's an enormous possibility there, which I think no one has attempted. I would put forward before youth to consider this. And Mr. Murli to also think about it, how to take it to them. It would have challenges of language, it would have challenges of, describing something, awareness levels. There is no point discussing amongst us at this level unless it can be taken to that level. And these ASHA workers during the COVID time actually did turn out to be their leaders. And therefore, I think it is imperative that we have to recognize that they are the most important cog in the will of dispensing, universal health care by using technology, by digital health, methodologies at that level. India has taken forward the giant initiative of building the digital health authority using digital data for improving health services across the country. So I think if we work together in this particular area, the parliamentarians and the local level, besides the parliamentarians, the local level members of legislative assemblies who are in charge of that particular village, or they could actually get involved. And I think the impact would be much more for anyone to see actually. The second thing that I wanted to, so first point is let's create grassroots health leaders using digital health technology, digital health. One of the thing is capacity building. The other aspect would be awareness creation. The third thing would be the ease with which they could probably educate their community of which they are in charge. Now they probably move from house to house, which is important, but they could probably also do it more frequently by using technology. Point which I would like to make is the fact that since in India we have a very strong and robust and universally acclaimed India stack in the digital space, already operating with the UPI system, the payment systems operating, and the Aadhaar, which is being available, and the equivalent of Aadhaar will be the national health identities, which would also be available. The next step would have been to have a separate health stack. So India Health Stack would actually be the next step initiative. We should all probably work towards that. Why it makes sense is because just in the last budget, which was announced by the Honorable Finance Minister just a few days ago, there was an announcement about India moving towards an agri stack. So if it is going to happen in agriculture, which is again a state subject, I think health would be much more, because I told you the National Health Observatory is already collecting that data. UPI systems are available for making payment. Unique identification codes are available, either Aadhaar or the new national health identities that will be there, and then mapping them with the various health services that are available across the country. I think there are tremendous values to be unlocked in by coordinating this particular activity. Since in India, the number of startups who are in the space of digital health have been increasing at an enormous rate. When I'm told that in 2016 there were just 452, and now there are 90,000, from 453 to 90,000. Startups in the health tech sector. Many of them do approach me, giving different kinds of, unmet needs of people of the country. Some mostly in rural areas, slums, minute details which I think no government can actually address, or no uniform government program with one-size-fits-all strategy can work. So these small applications, I think, needs to be promoted. This is something which again can be a kind of platform can be created where people, you pick up some of those applications, you give them the problems that you're facing, and then the startups probably can modify or customize, or maybe it is already there. Sometimes you don't know whether it is there or not. Therefore, if it is there, then you give it to that particular community, give it to that particular slum area where the particular disease is prevalent. Let's say sickle cell anemia is there in only few communities. And there the problem is, let's say you are having or thalassemia, having blood. So just link it to the blood bank database and give distances, and link it to the ambulances. So this kind of thing using digital health technologies presents an enormous potential in our country. India will continue to remain very young. It is a very young country now, and therefore there is no way we can reach universal health care in any manner unless the youth is involved. And I think rightly so, as Mr. Murali was making the presentation, the youth want to be a part of the process, and rightly so. The point is whether their voices are being heard, number one. Number two is whether the voices are being acted upon. Now, so if there are two issues there, then at least the easier part is to make the voices heard, and that the parliamentarians can eminently do. Whether the voices would be acted upon, that the ruling party parliamentarians will decide, or the ministers and the ministries will decide. But at least we would have taken one step forward and can influence that particular policy making. In India, as you know, we have one of the largest health insurance scheme of the world. It is the largest, not just one of the largest. It is the largest, the Ayushman Bharat. So under that, the Ayushman Bharat Digital Health Mission is there, which is operating to have a vertical integration, as I said, district level, state level hospitals, district level hospitals, and then the community level CHCs, and then the sub PSCs are there. And also horizontal integration, which is not happening now. You just go through word of mouth or various other ways. So that's, I think, where we can do this, and the public-private partnership models. That is there. Just to address the question of privacy, which is much more important in the case of digital health, excuse me, compared to other applications, other use cases, because sorry, it will affect the lives of people, lives of patients. Now, there, privacy would be an issue. Privacy would be an issue. Interoperability is an issue. Now, all these issues have been addressed, thankfully, to the passing of the recent Digital Data Protection Act just 6 months ago. The rules are yet to be operated, but they are yet to be notified. They would be, however. But in that particular bill, since I was involved right from inception, I've been involved in the making of this act through various iterations. I can say that there is a provision which says that in case of sectoral regulators, like let's say there will be a health sector regulator, then their prescriptions will or their restrictions or whatever, their regulations, their guidelines will take precedence over what is mentioned in the PDP bill. So therefore, since the health, digital health data, which is maintained in the digital space, requires a much more stricter interpretation of the privacy norms, that should be taken care of. However, I would probably think that instead of keeping it along with the other, the universal applications or universal application of the act across the country, it may be better to have a separate public infrastructure that in terms of a health stack, which is a good idea. I think we can probably move that and drive it. That would also enable the youth, because that would be done. The innovation has to come from the youth, and youth are the future in terms of giving innovations to society. And so these innovations will take it forward. And I think we as MPs should be able to help them. First, as I said, to give them a voice, but number two is also in the implementation. If each one of the is not just the MPs, each MP in India has 7 assembly constituencies, which means 7 MLAs are there, members of legislative assembly, so they can actually take it to the community, and that is when you feel you find or you see the actual impact of digital health. Otherwise, it remains more esoteric in the research papers or at the government level. It becomes evidence-based policy making, fine, but what matters is whether lives of people, the health of people has improved, the health services of people at the last mile has improved. whether access for them has improved, whether it has become affordable, whether it has quality has improved. If we can achieve that, then I think the true value of implementing digital health would have been achieved. So with this, I would only conclude by saying that yes, there are enormous possibilities, and yes, youth will have to take the driver's seat here. But it is not just the youth who are doing research or who are making these startups and all. It is the youth who are actually implementing this at the field level, and that's why I said the primary health workers, the ASA workers, the nurses, the paramedics in some remote hospital in India. Now, these are the ones I think we can rope them into not only giving better health service in terms of in knowledge creation, building their capacity, but also as to what is available. What is available in another state may not also be known to the other state. So I think this is the biggest advantage, or this is the biggest thing that we can contribute. I know it's a very tall order, but it can even if it can be done on a pilot basis in one particular state itself, that would actually be a model for the entire country. Thank you so much.
Thank you so much, Dr. Bhatnaik. It's always a wonderful experience to hear from you and your suggestions. Next, we have Honorable Kelvin Yee from the country of Malaysia. Thank you so much for joining, for joining, Kelvin. We know that you just landed, and it's actually amazing that you could join. So thank you.
Thank you so much for everything, inviting me to listen, to learn, and of course to share some thoughts on this very important topic. Just to give a very brief introduction, my name is Dr. Kelvin Lee. I'm a member of Parliament in Malaysia, and before this, I also served as the Parliamentary Select Committee Chairman for Health, and I was also appointed the Special Health Advisor to the previous Health Minister. So this topic is something that's very close to my heart. And I think engagement to the youth on this very important topic on digital health governance is something that is critical, and it's something that even Malaysia, we are looking at institutionalizing it, not just common engagements, but having structures in place so that we tap and we harness the potential and strengths of young people, especially when it comes to digital health. So just to give a simple background of Malaysia, actually, we have embarked on our digitalization in healthcare since the 1990s. In 1997, we actually codified the law when we first passed the Telemedicine Act in 1997. But along the way, of course, we encountered many obstacles, many challenges, many failures as well, when trying to implement a lot of different things that is important to digitalize the healthcare system in Malaysia. But I think since COVID-19, that has been the catalyst, that has been the pressure point to push us to further innovate. And that is where I think I was listening to Dr. Amar just now explaining about the circumstances in India. And Malaysia is a bit different because our healthcare system is centralized by the federal government. And each state has very little to actually no say in the healthcare system. So yes, it's good and bad. With different states having their own system, that helps competition, that helps innovation, and of course that helps policy pressure. But the good thing about a federalized and centralized system is that it's easy to control and it's easy to standardize in the different states in the region itself. And since, as I said, I was talking about COVID-19, and since then, I think the government has put a lot of pressure or even attention in order to fasten the whole digitalization process for our healthcare system. And that's where young people is also an important stakeholder, because you guys are the most advanced and most educated generation we ever had. And sometimes you have those ideas for innovation that comes from young people. So I think the 5 keys of digitalization that Malaysia is looking at is, of course, if I may share, number 1 is remote patient monitoring. Number 2 is emergency medical response, which is more patient-centered. Virtual palliative care. Number 3, enhanced interoperability of electronic medical reports. And of course, 5 is a hospital-based virtual clinic. This vision that we want to have is we want to have a house hospital. That means the hospital will be in the house of people, and digitalization helps pushes this dream or vision into reality. So I just want to share some of the efforts that we are doing, especially in trying to engage the government. In Malaysia, we have Malaysian Youth Council, which is to a certain extent is a recognized body under the federal government, and then we engage with them periodically, and with health as one of its main focus areas. So basically, young people will come to this platform and they will voice their opinions and policies to the federal government and create a lot of these ideas and also policy directions to be put in place by the Ministry of Health to address it, to just move forward. One of it, and then the government also does this digital health literacy program through the Ministry of Health. And this, of course, goes through the different regions, the different states, to have some digital literacy program aiming at increasing youth awareness and understanding of digital health tools. The other thing that is through this also we have what we call the My Health portal, which is where the Ministry of Health controls all their health policies through a portal, and this of course provide relevant information. And the fact is, a lot of them are run by the young people because we want to make it as simple, as attractive, and as user-friendly as possible. So there are other youth-led initiatives, even through the Ministry of Health, where we have what we call hackathons or innovation competitions. And some of the focus are actually digital health innovation competitions. That is where we have come up with many different ideas in addressing the 5 key pillars that I mentioned. And even startups, excuse me, that will start. Like in Malaysia, we have Doc to You, Doc to Us, Docs on Call. So these are multiple startups that basically embrace a lot of this digitalization and innovation, which the government also then gives a seed fund to them to start up. So this is through basically youth-led initiatives and innovation competitions that we do here in Malaysia. Of course, I think private partnership with youth-focused NGOs. This includes basically mental health associations, even AIDS and HIV councils on issues that affect young people, on how we can digitalize, how can we push digital information to the young people and let them have their views on certain things so they keep on their track and not arcade and our programs are also age. So of course, besides this engagement, I think what is important is also a representation of youth in decision-making processes. Basically, in the major health programs that the government does, even under the Ministry of Health, or even when we are discussing budgeting with the Ministry of Finance for Health, youth representatives for official groups are actually included in this decision-making platforms. And we even have intergeneration dialogues where we have hosted multiple dialogues on health issues, including digital health, where younger and older policymakers basically come together and exchange ideas. And of course, I think the young people were very heavily involved in actually doing COVID itself. The usage of social media is so important to get the message out, to get understanding, number one, on social distancing, on prevention, but more importantly, eventually on the so social media and digital platforms are important. So actually, a lot of young entrepreneurs were engaged to push out this message creatively, in a fast way, to capture the attention of the young people. So that is where there were digital campaigns called Sihat Bersama in Malay. Sihat Bersama means healthy together, where we use these digital platforms to push out. At first, it was COVID materials, and now we have utilized it to push out information on NCDs. So I think all these multiple initiatives, among others, reflects, I think, our seriousness in Malaysia to involve the young people in digital health governance and also initiatives. Of course, all these initiatives are good. For the next step, especially as we proceed further, as I said, the 5 pillars just now, and how Malaysia has an ambition to fully digitalize our report system, our medical report system by 2026, which is in 2 years' time. where the private sector and the government sector can share records together. I think the young people are very, very important because, as I said, young people sometimes think out of the box. They have creative ideas and innovation that the government are more than eager to harness and to partner in pushing it. So I encourage you, young people, please push, talk to your MPs, get involved, and who knows, be creative. And I hope the answers and give some input to this. Thank you so much for having some taxi.
Thank you so much, Honorable Kelvin. Thank you for your insights. Next, we have Honorable Niranjan Reddy from India. Honorable Reddy, the question for you is slightly different. We wanted to learn from you that what are the key barriers for youth in the existing digital health policies and how can policymakers mitigate those barriers? Please unmute yourself and go.
Thank you, Paromita. I wanted to thank Unite and Youth for this initiative. Instructive presentations by Arshia, Pallavi, and Sharan. I welcome my fellow members of Parliament from Asia Pacific region. I'll be very quick because I think Mr. Amar Patnaik has given a broad overview of the health system that we are operating in India. To enable the other speakers to speak for longer, I'll try to be very quick. In terms of barriers that are operating for more youth to be engaged in digital health related initiatives, there are two or three. Sharan touched upon one or two, which is how do we make this more interactive and engaging for the young people to understand that they would stand to benefit from their by engaging with these digital health related initiatives or improving their health. So I think the first would obviously be the digital divide that we have, the economic divide, the digital divide, the gap that we find with most people, especially in a country like India, where they would have these disadvantages of having access to these digital health initiatives. So I think the necessity of engaging with the largest section of young people would therefore stem from the policymakers or people like YO.DH, which are trying to be the bridge with this large mass of people who have these digital and economic disadvantages. So I think there are two things that I wanted to, but if you ask me what the barriers are, this principally is the major barrier. The second barrier, especially in a country and society like India, are in relation to various health-related issues, including mental health, the SRH-related health issues. That there's a social taboo that goes around if someone thinks that they're reaching out for medical help. So these two are primarily the barriers for most of the young people to reach out if they're otherwise not having the disadvantage. I think a great opportunity for an entity like YO.DH and Unite would be become a bridge. Like, for instance, if you are taking the mental health related issue, or if you're taking a substance abuse, including alcohol related issues, there are physical infrastructure facilities that are located. But the problem would be someone in Meerut, just to give an example, this is a small place in India. If they have a substance related health issue, or if they have a mental health issue, or if they are an SRH health issue, the young people who are not fully educated or not having these other advantages may feel diffident, or they may feel a social taboo. But if the digital platforms can become a bridge where you say, look, we will anonymize you. You reach out to us through our apps. We will anonymize you and we will send you to a center which is close by, but would be sterile enough for you not to feel that you will be stigmatized or you will become, you will be recognized. Then I think these kind of initiatives might help. Other than this, I think in relation to the barriers that may need to be, like I think Sharan had made a point about the parliamentarians aiding them and helping them. I think if we have to help you in overcome these barriers, apart from what Dr. Patnaik spoke, the other issue would be, like, as parliamentarians, we are on the legislative area. Most of the policies are worked out by the executive branch. So without going into details, where we will need help as parliamentarians is if Sharan, Pallavi, Paromita, Arshia reach out to us, inform us about the policy related issues that can be pushed by us, we have individual interventions. We will be able to make interventions in Parliament and try to see if we can push the executive in the right direction. So we will need help from you. And I think we are there to assist you. But yes, I think this is a work in progress, just started. Lot of difficulties. I think all of us have to work together. Thank you. Thank you, Paramita.
Thank you so much, Honorable Reddy, for your profound insights. Next, we have Honorable Habib Milad from the country of Bangladesh. Honorable Milad, please go ahead.
Thank you, Paramita. First of all, I want to congratulate all the youth of the world today on the day of International Youth Day. As you know, it's a powerful reminder of the crucial role of young people play in shaping our own world. The prime example is Bangladesh at the moment. As you know, that last 5 years, student-led revolution changed the government, and they have taken over. And as you know that we do not have any parliament anymore in Bangladesh, so nobody is a member of parliament at the moment. So we have to go through the interim government, and if we want to change anything, that should be within then. I do not know how long they're going to be in the power, but probably not very short. As I said that in this world, about 60%, 25% are youth. Their age is from 15 to 29, but Paramita told up to 35, so it must be more. And the 60% of this population in the Asia-Pacific region. That means that we cannot ignore or not involve youth in the policy. They are the majority of the population. If you think worldwide, 86% live in Africa, Asia, and America. So there is a difference between developing and developed world, especially when you consider youth. They are the power. We need to engage their power. We saw the digital healthcare system. We didn't have any idea before, or limited idea before the COVID. During the COVID, we saw the use of telemedicine, telecommunication, and these sort of things help in the health sector. In Bangladesh, we have primary health sector is very strong, probably everybody knows. And also infrastructure is very good, but implementation and giving the quality healthcare is not yet available for those who really needed it, especially poor people. So if we can implement digital technology, especially using the youth force in our country, that will take it forward. I'm sure about that. You will be happy to know that the ICT and telecommunication advisor, who is a full cabinet minister, he is 26 years old. He was leading the movement at the moment. So I hope that he will, or his team will understand how can we use digital technology everywhere, including health sector. Because if there is no political commitment from the higher level or highest level, it is very difficult to implement. As we know, the user of the digital technology, if you say young population of the world, 70% uses that, but overall is 40%. That means that the difference between youth and elderly or old is obvious. That means if we need to do something digitally, technologically, and you have to use the young forces, there is also some negative attitude towards young people. We thought that they are the social media type of people, they are using that. And also other barriers and challenges that limit the youth involvement, limited access to information. But I think digital technology can help in the health sector. Representation in decision making, they are not involved in our country at all, I'm sure, but that's happening now. Limited access to funding, mentorship, network and skills and opportunities. So we need to remove all those social barriers, those who are in parliament or influential policymakers. I know in COVID, we saw that we have promised to implementation universal health coverage, also sustainable development goal we want to achieve. But leaving these girls and boys behind, it is difficult to achieve really in any sense. So what we need to do, that we have to engage and utilize power of young people in all tiers, development, community, government, everywhere, then we can do it. That has started last week in Bangladesh. See how it goes, but we always want that, and we always want to see the result. And if this young-led government, of course, the chief advisor and others are old people, but the leading in position is the young people, they can make it success, it will be a model for the world. And we hope that as Bangladesh will lead, of course, in digital health sector, other sector that lead by the young people. I will stop it here to saying that digital technology and artificial intelligence, all sort of things are needed in Bangladesh, not only Bangladesh, everywhere in the world, to make everybody's life more comfortable and more to achieve universal health coverage and sustainable development goals. Thank you.
Thank you so much, Honorable. Thank you for telling us about the political context in Bangladesh as well. Next, we have Honorable Agnes Lam from Macau. Thank you so much for joining, Agnes Lam. It's so good to see you again. With you, the question remains the same, that what are the key barriers for youth in the existing digital health policies, and how can policymakers such as yourself mitigate those barriers? Please go ahead. Thank you.
Okay, thank you much, Mita, and I'm honored to share some of the information that what we're doing in Macau here. So I would like to tell you a bit more background. Like, I think the situation that we face here is a bit different from what other MPs in the other Asia part. So actually during the COVID, Macau implement something we call health code, and so that is a digital code that you need to generate from a mobile for you to enter any public space. So because of that policy, it was very strictly implemented. And so we kind of solved the problem of digital divide or inclusion issue. So basically every single person, I think, like, aside from kids, children that's under age 12, and so everyone, they just need to have a mobile phone and to access to any public space. And so even for some maybe elderly or people from the more living in a more kind of poor below the poverty line. And so there would be some kind of subsidy for them, and then they can apply for, and then they can get a cell phone. And so I think that, and also the way that we frame digital health here is more or less like an e-medical scheme. And so the government start to invest into infrastructure, 20 years ago, 2 decades ago. And so in the very beginning, that we have some program that every pharmacy, they need to digitalize their record of selling like the some of the medicine. Okay, so we started that. And so in the last couple of years, we already launched the kind of personal medical record scheme. And so individuals, if you go to the hospital, they can select if they want to store their information in their cell phone. And also they can select, they can decide if you want to share this, one medical report from one hospital to all other hospitals. So this is something we've been doing already. And so I think that for the infrastructure part, for the inclusion part, and then we're doing quite well. But when we're talking about the youth engagement, I have to say that here we focus on two things. One thing is that we don't have a youth council, and we have some MPs. They might systematically collect more opinion from the kind of young, from the youth through school channel or through some NGOs, or so they might doing that. But as the government, they do not collect, opinion or from the youth directly, so we don't have that. And the second thing is that here in Macau, that we've been promoting, or people are more concerned about the depression among the youth. And that's something we always turn to the digital health program. And so, like for example, I work with one of a professor from the University of Macau, and he also happened to be an expert from the WHO. And so we try to launch a program named Step by Step. So this is a digital mental health program to help people if they cannot access to digital mental health care, which is very rare in Macau. We don't have enough mental health doctor, and also psychologists. And so, but the digital mental health program will help people a lot. And then we found we tried to launch that program among different. It's a research program in the beginning. We tried to launch it among different groups, like migrant group, and also the young people group, the youth group. And then we find that actually the program can help the youth quite a lot. But then the next thing is that because as a researcher, I was an MP in Macau, but I'm now doing research mainly. I work in the university. And so I found that if we want to help the youth, they really access to this kind of digital mental health program, and then we need to be able to understand them and understand the problem and what kind of program we can help them. And then we need to have some kind of policy helping us to, engage youth in the research program or just for some kind of focus group. So I think now the biggest barrier is that on one hand, in Macau, I think also like in Chinese culture, maybe some of the culture as well, we have a huge stigma about talking mental health. So people are not comfortable talking about that. And so even that we find that our more pressing need may not be the infrastructure, but we want to engage the youth in the digital mental health program. But it would be hard for us to even engage the school or the NGO to ask the young people to talk about their feeling or what they need, because this is a stigma issue. So I think for MPs or for the parliament, and then we need to be kind of constantly telling people that, it's all right that we talk about mental health issue, and then, there should be some program helping people. And then the government should also we should not stigmatize this issue. And because I'm also from the Department of Communication, so we can still find that some media, they're still covering, issues or any kind of stories regarding mental health. And then we can understand sometimes they will still kind of exaggerating the stigma issue. So I think that we need to have some civil education here, and so we need to have a way to engage the youth in a way that they feel comfortable to talk about their issue. So I have the figure to share with you here that in 2021, the CDC Macau, they conduct a survey among all the young people from Form 1 to Form 6, around 13-year-old to 18 years old. And then we found 16% of this population, they have depression symptoms. They need help. But now we don't have enough psychologists that can really help the young people. And then so we need to, you might know that we need to a specialist for that. And now we don't have enough digital health infrastructure program, even APP, to want to help those people. So I think that if we want to really enhance people's health here in Macau, especially when we're talking about the youth health, so we need to advocate for non-stigma communication with the community, with the school, with the NGOs, and try to engage the youth in the next step. So we do some research, and then we can come out with some other more useful, or we can use even the AI technology. And because of the step-by-step program I just shared with you, and then we need to do something we call culture adaptation, because we bought the program from WHO. So in order to help people coming out from depression, we need to be able to ask different questions and answer different questions. And so we need to come up with a lot of scenario. And so the scenario we did before, if we collect those information through focus group. But you know that once we do focus group, it takes a long time for us to come up with a true program. So I think if we can also using the AI technology, and so then we can generate all those scenario quicker and also get the response quicker. So I think that we can really kind of launch I can say more effective program for the youth to gain this mental health. So and for other issues that here in Macau we will kind of there's one thing that we're not decided is that about the information protection privacy issue, because I just share with you that everybody basically that they can choose if they want to share their personal medical record through the e-medical scheme in Macau. So that's a government-owned program. But for the young people, adolescents, the law is not clear about what's their right. Can they do it, or their parents can decide that? So I think this is one part that we haven't decided. So in Macau, we face two major barriers. So one thing is about the digital health program. The other is about would the adolescents, they have the right to design their own data, okay, to keep on their private record, or they can just also choose to share with different hospitals. So this will be my sharing here. Thank you very much for the chance.
Thank you so much, Honorable Lam. It's always a pleasure to hear from you. Next, we have Honorable Member of Parliament from Indonesia, Honorable Puteri Anita Komarudin. Indonesia is a priority country for UNITE, but this is also Honorable Puteri's first engagement with UNITE. So, Honorable, a very warm welcome to you. And please, the floor is all yours. Go ahead.
Thank you, Paramita, for this opportunity. Honorable speakers, good afternoon. My name is Putri Komarudin, and I'm honored to serve as a member of the Indonesian Parliament in House Commission 11, overseeing finance, banking, and national development planning. Additionally, I represent the Bureau of Women Parliamentarians at the IPU, Interparliamentary Union. And as a nation of 281 million people spread across thousands of islands, Indonesia faces unique challenges in ensuring equitable access to healthcare. And in this context, digital health innovations are convenient and really necessary to bridge gaps in medical services across the archipelago. And according to Tech in Asia, 58 health tech startups are operating in Indonesia, with the gross transaction value expected to reach USD 16 billion in 2023 and grow to USD 34 billion by 2027. And the broader expansion of Indonesia's digital economy, projected to soar to US 360 billion by 2030, drives by this remarkable growth. And to harness these opportunities and meet the evolving needs of our healthcare system, policymakers must develop agile and adaptive regulations. And in a significant step forward, the Indonesian Parliament passed Law Number 17 of 2023 on health last year. And this legislation includes provisions for using information and communication technology in remote healthcare services, such as health tech and also telemedicine. And this provision provides legal certainty for platform providers, enhance access to healthcare services, and improve the monitoring of healthcare practices and products. And we are optimistic that this law will catalyze increased youth involvement in the health tech startup ecosystem. And currently, young entrepreneurs in Indonesia drive 70% of startups in our nation. However, health tech startups still comprise a small portion, representing only 3.2% of the more than 2,500 startups currently existing in Indonesia. And despite this, we firmly believe that with the proper support and encouragement, young Indonesians have the potential to create unicorns in the health sector, particularly in pharmaceuticals and healthcare services. And the recent pandemic has already shown the promise of health tech industry, as startups collaborated with ride-hailing companies to provide remote consultations, accelerate drug deliveries, and also support COVID-19 vaccination programs. And furthermore, it is essential for Parliament to support the state budget dedicated to advancing digital transformation in the health sector. And this year, Indonesia allocated USD 11.8 millions for healthcare, which is 5.6% of the state budget. And over the past 5 years, health budget allocations have generally increased, particularly in response to the COVID-19 pandemic. And while the rise in the health budget is significant, what is crucial is the emphasis on transparency, efficiency, and also targeted spending. And this year's budget, we focused on explicitly transforming the healthcare system, addressing stunting, a problem that is still very much exists in Indonesia, fostering a robust pharmaceutical industry, and strengthening the national health insurance program. And such targeted investments are expected to create valuable opportunities for startups in the health industry and drive further innovation. And one of the critical components of the health law is integrating various health information systems into a unified national health information system. And this integration will enable individuals to access their health data while also ensuring robust data protection. And a significant challenge in our healthcare system is the fragmentation of health data, exacerbated by the proliferation of health applications and the need for standardized regulations for data exchange. And in 2021, more than 400 health applications were developed by central and local governments, with additional applications created by third parties and also health institutions. And another pressing issue is that much of our health data is, they still need to be documented manually. In many regions, healthcare facilities rely on paper records, with over 80% of these facilities yet to adopt digital technology, a problem that I know must exist in every third world and developing countries. And this reliance on outdated methods has resulted in health policies not based on comprehensive and clear data, and has contributed to inefficiencies in our healthcare services. And in response to these challenges, the Indonesian Ministry of Health has developed a blueprint for digital health transformation strategy for 2024, which aligns with the health law. And this strategy focuses on developing integrated health data and service applications, and also nurturing a sustainable health technology system. And these efforts aim to enhance the quality of data and inform better health policies, in ultimately improving the efficiency of our healthcare services. And key outputs of this strategy includes the Indonesia Health Services platform and also the Citizen Health app. And the IHS platform is designed to address a long-standing issue related to integrating various health applications. And it simplifies the process for health industry stakeholders to integrate with a single health data system, ensuring that all health transactions are recorded and utilized effectively. Meanwhile, the Citizen Health application is a comprehensive platform for storing personal health records, allowing users to access their health information and also receive personalized health recommendations for maintaining optimal health for each individual. And these platforms integrate all aspects of healthcare, ensuring optimal effectiveness and also interoperability across primary and also secondary care, pharmaceuticals, medical equipment, national health security, human resources, financing, innovation, and all the updates within the biotechnology ecosystem. And the digital health transformation strategy represents a fundamental shift towards a more straightforward, user-friendly health services for the public in Indonesia. And by ensuring easy access to high-quality health data, we can significantly enhance the efficiency and also effectiveness of our healthcare system. And furthermore, we believe data integration is crucial, especially when considering the health data of Indonesians pursuing treatment abroad. The Ministry of Health estimates that nearly 1 million Indonesians choose to receive medical treatment overseas each year, resulting in a potential economic loss of up to 11 million USD annually domestically. And also, we must continue to emphasize the importance of cross-country collaboration to expand data integration and strengthen the digital health ecosystem. And in conclusion, the future of healthcare in Indonesia lies in embracing digital transformation and by fostering innovation, supporting our young entrepreneurs, and ensuring robust data integration. We can create a healthcare system that is not only more accessible, but also more efficient, sustainable, and also effective for all. Thank you for the opportunity, Paramita, and hope to see you in the next event.
Thank you so much, Honorable Potere. Thank you so much for your insightful contributions and also for giving us an entire overview of your country's context, Indonesia. Thank you so much. Next, we have Honorable Ramesh Paudel from Nepal. Honorable, since we are running a little short on time, could you please share your concluding thoughts? We have two more speakers. I ask everyone to please bear with us. And thank you so much. Please, Honorable, go ahead.
Okay, thank you, Paramita, and good afternoon, everyone. I'm Ramesh Podel. I'm an ex-member of parliament from Bagmati province of Nepal, and I'm a working committee member of Asia Pacific Parliamentarians Forum for Evaluation.
We are not able to hear you, Honorable. Honorable, are you there? Okay, I think we can go to the next speaker. So the next speaker unfortunately couldn't make it, Honorable Member of Parliament Pradyut Bordoloi from India, but instead his advisor Aditya Ramakrishnan is here to represent him. Aditya, please go ahead. The floor is yours.
Thank you. So, good afternoon, everybody. My name is Aditya Ramakrishnan, and I'll be representing the Honorable Sri Pradyut Bordoloi for today's event. Mr. Bordoloi is a second-term MP from Nagaon in the Indian Parliament's lower house, the Lok Sabha. Prior to this, he served as a minister in the Assam state government for 15 years. And among his various areas of interest are health, cancer, and anemia, particularly in India's northeast. Unfortunately, Mr. Bordoloi could not attend today's call himself as he's currently traveling. Instead, I'll be reading out a short statement from him. The question that's been posed today is particularly relevant given the size of the Asia Pacific's and India's youth population. In 2022, the government estimated that the average age of Indians was only about 29, making ours one of the youngest populations in the whole world. However, this does not mean that the youth are monolithic and that a one-size-fits-all approach can be adopted for engaging youth across the world when it comes to digital health governance. While the world is fast digitizing, there remain severe inequalities in access to digital infrastructure, which are decided by region, gender, class, and several other factors. There exists a massive divide between developed and developing countries in access to the internet. It is estimated that 81% of the developed world's population uses the internet, as opposed to only around 40% in developing countries. Even within countries, there exist divides, particularly between rural and urban areas. Region 2 plays a major role. For example, many states in India's northeast, from where Sir comes, lag far behind the national average for rural 3G and 4G coverage. So engaging youth in the Asia Pacific requires a bit of a tailored approach. A good first step might thus be to assess the context one works in. Digital health should complement existing infrastructure, and so one needs to collect information on existing health and internet infrastructure. Good data and research are necessary for good governance, after all. This would help to understand who requires interventions and how badly. It also avoids the possibility of investing in high-tech solutions that end up being incompatible with the needs and preferences of its intended users. Now, such an assessment could be done in multiple ways, including, for a start, a literature review, which is informed by young people themselves and sources they suggest, which might sound unconventional, but could yield valuable information in the end. Community outreach at this stage is also important before making any interventions. We must first understand the communities who we seek to intervene in, especially because literature and data might not be available on them. In this stage too, young people should be one of the primary demographics that are engaged with. Youth can also point to other stakeholders who they think must be consulted, such as community leaders, teachers, and so on. Or they can be trained as data collectors themselves. Youth must thus be involved in all steps of governance, deciding which technologies are most appropriate, how to implement them, and to what extent. Another key area that must be worked on while engaging youth is also language. Much of digital health content that comes out, at least in India, is in English. automatically making it inaccessible to the majority of youth in the country. Now, as a remedy to this, efforts should be made to deliver content and translate it into local languages too. Cultural context and local values must also be factored in while engaging youth, understanding that priorities and needs can differ between geographies and even communities. Adopting a one-size-fits-all approach can deter youth from wanting to engage at all. So while frameworks and models might have to be scalable to the regional or national levels, the consultations that go into them must be specific to some extent to ensure the implementation of the end product can be flexible. Thank you.
Thank you so much, Aditya, for being so concise and for your insights. We come to our last speaker, Honorable Podial. Is your audio working?
Yes, do you hear me?
Yes, I can hear you clearly, Honorable. Please go ahead.
Okay. I'm Ramesh Podel from Nepal. I'm an ex-member of parliament from Bagmati province here, and I work. I'm a working committee member of Asia Pacific Parliamentarians Forum for Evaluation. To come to the topics of today, I want to give a kind of a context of the constitutional provision here in Nepal. The Constitution of Nepal broadly defines the exclusive and concurrent mandates of 3 levels of government, including for health policies and services. Exclusive mandates refer to those responsibilities that are linked to a single sphere of government, whereas concurrent mandates are shared by 2 or more spheres. However, the Constitution does not clearly articulate the specific locus of accountability and responsibility of the health-related policies and services. To help clarify this responsibility, the mandates for different levels of government are elaborated in 2 key documents. The functional analysis and assignments specifies mandates and functions across all 3 levels of government. The Local Government Operation Act defines the roles, responsibility, and rights of the local government, along with other provisions related to the operation of local government. Additionally, many laws have been enacted at the federal level in various sectoral or thematic areas, such as the Public Health Service Act, which also defines the responsibility of different levels of government in specific areas. We have both private and public health institutions, with the private services often considered expensive, while public or government health institutions offer health services either free of cost or nominal charges for specialized care. When we're discussing digital health policy, we must consider the roles and contributions of both private and public health institutions. Since we are running out of time, I would like to go and mention only 2 key area of barriers and necessary actions we could take in the policy for the youth in existing health policies. The first barrier is a digital literacy gap. We have many young people, especially in the rural areas of Nepal, they lack the digital skills necessary to navigate and use digital health platforms and platforms effectively. To mitigate this gap, I think we should integrate digital literacy programs into the education system and provide targeted training for youth, especially in marginalized community. Another barrier is limited infrastructure. We have insufficient internet connectivity and limited access to digital devices, particularly in remote areas, make it difficult for youth to access digital health services. As a mitigation strategy, we should invest in expanding internet connectivity and access to digital devices in underserved areas, potentially through public-private partnership. I would like to stop it here, and then thanks for this opportunity. Thank you all.
Thank you so much, Honorable Patel, and thank you for being so concise as well. I think we have come to the end of our session. We have run over by 30 minutes. I apologize for that. But I think I hope this session was of value to everyone. I see Honorable Paudyal and Honorable Lam here. Honorable Lam and Paudyal, thank you so much. Other MPs had to leave, unfortunately. Sharan and Pallavi, if there are any questions that you have for our parliamentarians, please write to us and I can directly ask them the questions. And similarly, I'll also ask them if they have any inputs or feedback for this session and we can write to you. Arshia, is there anything you'd like to add? And then we can maybe end the session.
And just a special note of thanks to Sharan and Pallavi for collaborating, and to all the parliamentarians who've joined us and the participants from the youth community as well. And we hope that we're able to collaborate more in future. And thanks a lot for all your inputs.
All right.
Thank
Thank
you,
you so
Arshia.
much.
Thank you, Paramita.
Of course. Thank you so much.
Thank you, team.
Thank
All
you.
right.
Thank
Bye-bye.
you. Bye, guys.
All right. Bye.